Hi, I'm Dr. Jerry Montagna with Health by Lights. I want to talk about using the Super Pulse laser with elbow problems. And elbows can be connected not only with the elbows, but you can do wrists and all kinds of things. First thing I want you to realize on the Super Pulse laser, it produces 3 nanometers. A 660 nanometer, an 875 nanometer, and a 905 nanometer, all at the same time, so it'll go deeper into the body. Let me show you on a chart here. This is the device here. This down here is the skin. The 660 nanometer will only go so deep, and then the 875 will go deeper, and the 905, which is a true laser frequency, will go much deeper into the body. That's why you have all 3, so you can treat all 3 of them properly and not just buzz through them. Because it has the laser, you have to have pulsing in order to have the laser safe. This device is the first device that was certified by the FDA to be able to sold over the counter to the patient. It is that safe, that nobody's ever been hurt with it. It is set up to be able to you could use it at home and treat. You won't have to go to the doctor all the time, which is what a lot of people are wanting. Has 3 settings in the pulsing. The pulsing, it has setting number 1, it does a 50 hertz. Setting number 2, it does a 250 hertz. Setting number 3, it does a scanning from 1000 hertz to 5000 hertz. And it'll scan back and forth. And if you listen to it when it's doing it, you can hear it hum to you. So setting number 1, the 50 hertz, is for general health. Brings circulation, relaxation of muscle, brings circulation into the area. Setting number 2 will help get rid of some stiffness and bring circulation in and promote healing and regeneration. Setting number 3 is for inhibiting it, get rid of pain, getting rid of muscle spasm. So that's kind of how you use it. Let's say that I have pain in my elbow, and because I have pain I want to get rid of, I'm going to go setting number 3, and then I push the start-stop button and it's pulsating. Let's say that the pain is here. I will go here and treat that. But with light therapy, it's not like ultrasound or electric stim. You want to envelop the whole area. So I will treat that for, particularly if that's the area of pain, I'll treat it for 3 minutes, maybe 5 minutes. And then I will move it to another spot. Now, always do it skin to skin, not against the clothes. And you want to put a little bit of pressure, because when you just put it on there, the blood will absorb the biggest percentage of the light energy. So you put a little bit of pressure. You don't have to bear down, but just put a good bit of pressure to stop the blood from flowing underneath, or at least cut it back, and you can get down deeper into the body. So then I would come all around that spot that's hurting, and even the backside. And I would probably even go above and below. And then I always go into the crevice of the elbow. And I don't care what joint you're doing, whether it's the elbow, whether it's the shoulder, whether it's the hip, knee, you always want to get up inside. Even though the pain may be out here, always treat up inside. And I usually finish with that. But I will go, if the pain is at the elbow itself, I definitely will go below it, above it, over it, and then up into the crevice. Now, if I'm in an office setting, I'm going to do over the pain area for about 5 minutes, and then over the next 10 minutes I will go around. I will spend a minute or 2 here, a minute or 2 here, a minute or 2 here, and then I will spend 4 or 5 minutes up into the crevice. If I'm sitting at home, do 5 minutes each area. What do you got to lose? This thing will just keep going and going, and not a problem. On a charge, you'll get up to 8 hours worth of use, so you can just keep using it. Now, that's if you have pain. Now, once you get rid of the pain, then let's say that you just have some stiffness. You can still use the 3 again, but as it's improving, you could go to mode number 2 and get it going, and then that helps with stiffness and general rehabilitation and general healing. And then, once it's feeling pretty good, then I would go to mode 1, start it, and that brings circulation in the area, relaxation, and just general health to the area. Now, you can use any of the settings and you're not going to hurt anything with it. But if you learn how to use each individual mode, you get just a little better results. Mode 1 is general health. Mode 2, general health and bring relaxation to the muscles and will bring circulation to the area. Mode 2, stiffness, health, a little bit of pain. Mode 3, I want to inhibit. I want to get rid of pain. I want to get rid of muscle spasm. I want to get rid of the sting of a bug bite. You know, anything you want to get rid of, that's where you use mode 3. It's really quite simple once you understand the 3, and you understand it has the 3 nanometers that will allow it to go deeper than most other devices. You know, especially for the money, it's the best thing for a home device, which again is what it's been FDA cleared for. I'm Dr. Jerry Montagna with Health by Lights. If you have any questions, you know, contact us on the website, and we'll be glad to try to get them answered for you. Thanks for listening.